Hello there. Hi, everyone. Welcome to this Clean Air Day webinar. My name is Chris Large. I'm one of the partners at Global Action Plan, the charity that coordinates Clean Air Day. I'm delighted that you've joined us today on this webinar. It's a really exciting day for Clean Air today. We have over 500 events taking place across the country. The campaign is trending on Twitter. We have BBC, Sky and ITV coverage today and coverage in the Times, Telegraph, Guardian and Daily Mail. So you join us at a very exciting time. The sorts of things going on around the country are schools doing walking buses. There are some street closures and street festivals in places like Edinburgh, Southampton, Glasgow, Leeds and Manchester. There are free breakfasts for cyclists in Islington and Leeds and free park and ride tickets in Chester, free metro travel in Manchester. Health professionals are getting on board in Bristol and Waltham Forest, and there are electric car manufacturers bringing fossil fuel free cars to test drive in places like Lambeth, Harwell and Richmond. So there's a lot going on today, but without further ado, we're going to move into the subject of this webinar, which is on the subject of engaging with senior stakeholders within our organisations to bring our organisations forward into tackling air quality matters. And so I'm joined today by three fantastic individuals who are going to share their stories of engaging with others in their organisation. And first of all, Professor Stephen Holgate, who will share the science behind air quality issues. So Stephen Holgate is Professor for the Medical Research Council and the Clinical Professor and Chair of the Air Pollution Working Party at the Royal College of Physicians. Stephen is with us on the other line and will pop up when the moment is right for his presentation, and he will speak to us first. I'm also joined on my left by Jamie Quinn, who is the Corporate Responsibility and Environment Director at Engie, which is one of the business partners in Clean Air Day. And on my right by Teresa O'Brien, who's the Corporate Sustainability Environment Lead at Investec. And both of these organisations have been working on air quality matters for the last few years, and so I think they've got some really interesting stories to share with you. Okay, we also have two other elements to share right now, which is about the audience participation. We are going to ask you some poll questions as we go through. They're simple multiple choice questions which will pop up on your screen, and we'll have the first one in a second to get an understanding from the audience here of your current work on air quality or not, whether this is something you're just starting with. And what we'd also really like to invite you to do is that 15 minutes at the end, we have a Q&A session, and we'd like you to type in any questions that you have in the box marked Q&A. Type it in there at any point and click send. We will then gather those, and when we get to the end, we'll take all questions on all three of the presenters' comments. So first off, we will do the first poll question, which you will see popping up shortly. This poll is a question of what type of sustainability programs has your organisation been running? Okay, so we're going to give you a few seconds just to submit your answers to this. You'll see a multiple choice list should be in front of you on the screen. And what we're looking to understand here is how widespread the air quality campaigns have become. What we found out from that is that energy efficiency and waste reduction and recycling are the two most popular campaigns. And we see that air quality, I can just see it on my screen now, 45% of respondents here say that they have done some work on air quality, but that's compared to 75% on waste and 80% on energy efficiency. That's not a surprise. I think air quality is an earlier field, isn't it? So let's hear now from Professor Holgate, who will share the latest research on the health impacts of indoor and outdoor air pollution, which is really the motivation for us to act on this topic. Stephen, over to you.
Thank you very much, Chris, and welcome. This is a terrific opportunity to draw attention to this terribly important public health crisis we're now entering. I remember in 1950s, being born in Manchester, the smogs in those days, and the importance of the Clean Air Act that came in 1956, that was transformative in terms of improving lung and heart disease at that time. But obviously over the last 50 years, things have deteriorated, largely with what we're doing in lifestyle, especially with motor vehicles and the internal combustion engine, and air pollution from emissions from those combustion engines are now causing real problems. There's been an estimate by UNICEF that about a third of the children in this country are living in toxic air pollution. I mean, this is totally unacceptable. And the problem is you can't taste it or see it or feel it. The air pollution, different from the smogs in the 1950s, is invisible. But it doesn't mean it's not there. Just as when water is poisoned, you can not see it necessarily, but it can exist. So what are the problems we're dealing with here? Well, we're dealing with small particles and gases which are inhaled, pass through the delicate membranes of the lung into the circulation and reach all parts of the body. Causes lung disease like asthma and COPD, but also heart disease and strokes. Of particular importance, however, is the recent evidence suggesting that other organs are affected, so type 2 diabetes, dementia, accelerated skin aging, and other diseases which we associate with lifestyle are all made worse by air pollution exposure. When does all this occur? Well, it occurs across the life course, from the time we're conceived to the time we die. There's both acute effects of pollution and a long-term cumulative effect of pollution. And still today, we're seeing the effects of pollution in the early 1950s having effects on mortality currently. A particular population that's at risk from pollution, of course, are children. They're exposed to pollution largely because they are smaller and are breathing in the traffic fumes more easily, but also because children have lungs and other organs that are still developing, that are more susceptible to the effect of pollutants. And I think the important thing here is to emphasize, as UNICEF is now saying, that a large proportion of our young people now are being exposed to these toxic chemicals, which are adversely going to affect their health, not only currently, but in the future. Indeed, the United Kingdom has the highest prevalence of asthma, one lung disease, in the whole of Europe. This is really quite unacceptable in a developed nation. Where do the problems lie beyond the emissions from vehicles? Well, of course, they lie indoors, inside the places we live and go to work and go to school. For children, it's schools and the home, of course. 80% of children spend most of their time in the house, and in fact, 80% of their time is spent indoors. So we're now at the Royal College of Paediatrics and Child Health and the Royal College of Physicians. We're going to launch a detailed inquiry into the effects of indoor air pollution on children's health. By children, I mean youngsters all the way through to 18-year-olds. And in addition to the indoor air, which gets into houses containing the pollutants from vehicles and other sources, we're looking at what we're doing inside the house in terms of contributing to toxic chemical substances. Tobacco smoke's the obvious one, and when it's inside the house, it can react with chemicals and make it even more toxic, particularly in the long term in relation to cancer. Cooking fumes are another area of interest. The use of aerosols, hairsprays, and cleaning products. Formaldehyde and volatile organic chemicals coming off from our carpets and furniture. The use of pesticides, flame retardants in our furniture. The biological pollutants that accumulate in house dust, accelerated by warmth and moisture, such as fungal agents and various allergens from dust mites and from pets. And of course, heat itself can cause a problem when it's mixed with the chemical insults as a stressor for these different diseases. So we're starting our new working party report. It's an exciting one, and I think industry has a really important role to play here, because obviously house building and the ventilation of our homes, the generation of materials we use in our homes, and how we actually think of our homes as custodians of our young people have to interact, I think, towards better advice in this particular area. And I'd like to see at the end of our study in 2019 that all the evidence we've accumulated on the toxic effects of outdoor air pollution are going to then add to those that are going to be given by indoor air pollution, and that we may be able to do something to mitigate those effects as well. The young people are the future of our country. We have to look after their health. I would like the UK to take a real lead here. We're a country of great innovators. Why can't we take a lead in all of this and try now to move forward and take the rest of the world forward with us in getting air quality fit to breathe for all of us?
Thank you, Stephen. That's fantastic, a fantastic summary. And any questions for Stephen, please type them into the Q&A box now and send them over to us, and we'll hold on to those for 15 minutes while we speak with Jamie and Teresa. We have one more poll question before we do. We'd like to ask you, what are the biggest barriers to influencing senior management in addressing air quality in your organisation? So those questions should pop up on your screen very shortly. What are the biggest barriers to influencing senior management in addressing air quality? You should be able to see those now. We'll give you a few more seconds to answer that question. The purpose of asking this particular question is so that hopefully in the stories of Teresa and Jamie, you'll find some solutions, some ideas, some inspiration as to how best to make the cut through with all of the busy lives that we know our executives have, and how we can make this agenda come top of the list for long enough to have them make some useful statements and some useful contributions to tackling air quality. Okay, quite a spread. We have the business case is coming out quite high. Making sure that the impacts are tangible is coming out quite high. And it's something that is not yet on the radar of leaders is also high up there. That air pollution also doesn't feature in CSR reports and in the CSR focus at the moment. So let's start on this topic with both Jamie and Teresa. And Jamie, I might come to you first with the first sort of multiple question of how did you build the business case to tackle air quality in your organisation, Engie, and what resonated with staff and the senior management? And then I'll come to you, Teresa, on the same questions.
Okay, start with some easy ones there, Chris. So, good afternoon, everybody, and good to have this opportunity to speak. I guess if I may, before getting into the answering, a big congratulations, really, on the same lines as from Stephen to Global Action Plan for, I guess, galvanising, the awareness, the numbers, the contribution, and the engagement around the UK on this topic. I think clearly it's been a hidden consequence, and I think it's really great that there's so many partners and public and private organisations and community groups really getting involved. So I think it's a fantastic thing. Now, in terms of answering your questions around the business cases, so just picking up on actually the point you made around how do we get this to the top of the list for the executive. I think what we found is it's really important to take a step back and look at how we align with existing strategy. So rather than it being rising to the top of an agenda, how can it complement existing agenda points that are there on the radar for the executive team? And we were fortunate enough that there are a number of things we're looking at in the business around growth in green mobility, around transition to EV, investment in EV infrastructure, understanding indoor and outdoor air quality, as well as our investment in green energy, which kind of complemented very well what we achieved within our organisation. So it might be worthwhile me just setting out for the audience who aren't aware some of the key things that we've been doing within Engie. So we made a commitment, actually it was this time last year for the inaugural year of Clean Air Day, on our transition of our vehicle fleet. So we have about 3,000 vehicles in our fleet, and a commitment to get 20% of those onto electric vehicle by 2020, and a further commitment to having zero diesel in our fleet by 2025. And so I think, this is rolling back 12 months, 18 months ago. The topic has continued to gain awareness, but I think we were quite forward thinking in that commitment. And how we tried to get that business case was the first step. There are a number of steps, but I think the first one was around alignment with existing strategy and it not being seen as an additional bolt-on. I think the second is really, some hard and tangible evidence around the business case. So our fleet manager, spent lots of time looking at what vehicles we do have, applying a sort of methodology around which ones would be suitable in terms of the transition to EV. Looking at, very importantly, whole life costing. So we all know that the initial upfront cost of EV is still more expensive than your internal combustion engine vehicles. When you start to look at the running costs, some of the tax benefits, the maintenance costs, the economics stacks up that sits behind. And importantly, we needed to start looking at it's not about just going and buying a vehicle, it's around the auxiliary support, the infrastructure and such like that's required, and how do we make sure we cost that into the business case also. So it was quite, I'm not going to sit here and say it was an easy process. It was quite rigorous. It took a lot of time, a lot of scrutiny between various members within the organisation. But I think once you've got that credible economic argument, it really starts to help the discussion. And there are a number of other steps around that in terms of, the internal engagement, understanding. I think, for people on the webinar now, I guess I would share some tips of, it's not about just going into the executive board and trying to persuade them to agree to a objective or a commitment. All the work is done in advance of the exec board. Yep. It's just a gateway, the exec board. So it's really around understanding what are the drivers for the people around that table.
Okay, well, we'll come back into that in a second, and perhaps what the biggest challenges were with some of the senior management in a second. But I want to ask the same question to Teresa, which is Investec's a different type of business. We have a lot of city centre workplaces. And so I guess the focus is a little different. How was the business case built for you, and what was it that resonated with staff and senior management around air quality?
Okay, thank you, Chris. So we worked with Global Action Plan since about, I think our relationship started back in 2006 or so. We launched our team of environmental champions a long time there. And so we were building up our stories, I guess, around just looking at things holistically, really. And so we started to build our environmental management system. So we had the energy, the waste, the water, procurement, business travel. And then we kind of thought, well, all of the activities in these areas affect air quality, so let's look at air quality as well. And at the time, the City of London approached businesses in the city and asked to pledge their new air quality pledge. So that kind of rose our awareness. We had to engage with our senior management at that stage because we needed it to be signed off. They did it willingly. We were one of the first 11 to do so. So we were on the right road, I guess. But primarily, we have a lot of buildings in right across the UK. Our largest one is here in London, where we have 3 of them, about 2,500 people overall. And essentially, no matter whether you're a senior manager or a post-room person or whatever, we're all breathing the same air quality. We're all commuting. So I guess they understood it from basically being human, that whatever affects, whatever air quality is out there is going to affect them, excuse me, as well as everybody else. So there was no... it was very easy thing to do. Really.
Well, that's great to know that sometimes it's easy. What do you think was the key for it being so easy? Because I guess there's the economic case, isn't there, that Jamie was describing at Engie. Was it around the health impacts? What was it that really got the managers to say, yes, we absolutely have to educate our staff on how to avoid air quality issues?
Yeah, well, like every company, we really value our people. We're nothing without our people. We're expecting them. So on one hand, we're learning about all the problems with air pollution in the world and in the UK specifically through lots of different ways. I guess through the media, we're getting a bit more interested in this. So I were encouraging them to come into our offices. We also needed to help them to be aware of the issues. So we've run 3 campaigns since about 2014, all at different levels, different little messages. But yeah, sorry, I may have lost my
No,
train of thought there.
Focusing on the health. On
health. So it's all around people. I mean, we're nothing without people. So
Yeah.
just really trying to help us, and also when we're in the city and other areas, all of our offices are based in some city or other. What we do and how we commute affects the people who live in those cities, who have no other choice but to live in those cities. Right. So it's a people thing.
Okay. All round, not just the people who work for you, but also the people in the local community, your customers, perhaps. Mm-hmm. Great. Well, let's go on to the trickier question: what the challenges were, and I'm sure our dozens of viewers out there will be really keen to hear how you got over some of those objections, what the initial objections might have been, where there were some, whether it was just too busy to think about this, or actually I'm not sure I agree, I don't understand the science. What were the sorts of things that you faced? Who would like to go first, Jamie?
Yeah, sure. So, I mean, you've just listed, a few of those. I think we had the fortune that we had somebody who had time and resource to be able to invest in looking at the business case, and not every organisation will have that. So I think that's one challenge that people will need to overcome. I think sometimes there's an expectation that things can happen overnight. And again, on being very honest, these things take a lot of time to research, to build up the business case, to get agreement, and then to implement as well. The implementation phase is like any project. You will have some things that go easy and some things that aren't so easy. So to give you some practical examples, we found that we said that if you're an employee and you transition your existing vehicle onto electric vehicle, we'll put a home charge point in at home for you, free of charge, and we'll provide you with an incentive in terms of a favourable rate for pence per mile that we'll pay. So we thought that was a sensible thing to do, and we still think it is a sensible thing to do. But what we found was that a big majority of our workforce didn't have off-road parking. Some of them are in landlord premises, so they need to get permission around that. And actually, even where some of them do own their own houses, they were a bit concerned of how much sort of mess is this going to take up, and is it going to all the decorations going to be made good? And it may sound simple, but these are the sort of practical things that, when you're getting to operational delivery and implementation, can be significant barriers around a project. And I think the lessons learned for us is that. That having gateways for reviewing how the project goes is really important. So we have, on a monthly basis, I chair a steering group, if you like, that all of the players that are involved in making the project happen come back and report on these learning points, progress, and then we can sort of tweak policy and implementation accordingly.
What are the roles of those players? Just the job titles. What sort of job titles are crucial to having this journey with you?
It's a good question, and it picks up on a point from Teresa around employee engagement, and we have our rewards director on there. So I think we shouldn't miss the point here that, for today, for example, we're launching our green car scheme. So this enables all our employees to, it's like a salary sacrifice scheme on cycle to work, but for vehicles, if they're low emission vehicles. So our reward director has really helped us to drive that. But we've also recognised employees are humans, and people who live in communities and accept and see the impact from these social issues. And if we want to position ourselves as an organisation that is leading and responds to these sorts of issues, we have to do these things. It's right for us to do these things. And indeed, it will help us around our ongoing employee engagement, recruitment and retention. And I just wanted to make that point because I think it's really important that the role of business in being an active player to address some of these global needs is very, very important. So the rewards director is one. We have our EV and infrastructure head. We have our fleet head. We have our HR director. So it's a broad mix of stakeholders that are needed to help us make this be effective.
Great. Well, You've both really picked up on the point of your own people and how this is important subject to address for the sake of health and well-being of the workforce. Teresa, it sounded like your journey was a little easy to get some of the sign-off. Were there any challenges with the senior management sign-off, or perhaps were the challenges around engaging with the wider workforce?
No issues with the senior management engagement, and mostly it was convincing. It was around convincing somebody to take interest in something they can't see, they're not aware of. They see this lovely sunny day, let's walk, let's run, let's, you know. And then to convince also because we're the largest of our offices based in London, and we have, as I said earlier, lots of regional offices. And so getting those guys interested, because as far as they were concerned, it was a London issue. It wasn't, you know, they're in leafy Cheltenham or somewhere. They didn't expect it to be there. So to convince them that otherwise. And also when we came up with our greener routes, commuting routes into the office, to convince people that it was worth their while to take that extra little journey. It may put 2 or 3 minutes on your journey, but that it would be worth it for their own optimum health. Okay,
and how did you manage to overcome that? What was it that you either said to people or showed people that got them to see that there was a problem there?
So we tapped into, there are air quality monitors in most cities, so we were able to access them and did some research, and were able to go back to each individual city or office and let them know what exactly air quality was like in those cities, and came up with a greener routes, as I say, in from the most popular train stations, for example. And we also were very, very lucky to be working with GAP at the time, and Barts Health, King's College, and we were able to carry their black carbon monitors. So I carried one of those for a day or so, and just literally looked at it. As you said earlier, it's all about the science. There is huge science behind this. We're not just making this up. And so that really resonated with people. And indeed, we 3 of our senior people took a monitor a day. Our CEO took it on his person and walked. He walks in from a local station here, so he walked in and out of the office. Another chap cycles to work, so he carried his air monitor there, and a third one drove in, so he did it from a driving perspective. And we were able to look at the browner routes and the greener routes, and by taking a greener route, how much air pollution you are exposed to in both routes, and it showed by, I don't know, about 37% better to travel in a green route. So there you have the science was behind it. So that was engaging.
Great. Well, I think that's a great tip. One way of engaging the senior managers to have them themselves involved in these sorts of experiments, see what the pollution exposure is on their own journey every day. And that if you can get some advocates then who say, yeah, we really have to do something about this, that's a great way of getting that message across. Stephen, I might hand over to you in a second just to ask how you would bring this to life for a chief exec of a business that you would like to be taking more action on air quality. I'll come to you in a second. Visualizing air pollution is one topic that's cropped up. It's something we've just done a mini experiment on this, where there's the equivalent of like an infrared camera, but it focuses on pollution. And so you can actually see the pollution coming out of the back of a car, for example. So you may see some of there's a story in the press today about the toxic school run. So that's an experiment that we've just done to visualize the pollution exposure. So that's worth Googling today and having a look at that story. But Stephen, over to you. What would you say to get a CEO who perhaps doesn't quite understand the challenge yet to fully grasp the issue that we have here?
Well, we're at a tipping point now. I mean, the scientific evidence is overwhelming, as we've already heard your 2 colleagues say. And in fact, there's no safe level of air pollution anymore. The science has gone beyond the limits that various governments are setting. And if we really think about this country, along with the rest of the European and other countries around it, are going to change. I mean, this is going to change. Now, the question is when and who are going to be the leaders here. And the way I see this now is not if, it's when. And I think the UK, with Brexit coming, we have a real opportunity here to become leaders in this area and set by example. I mean, I'll give one quote, really, which is the National Health Service. It employs 9% of the population in this country. I mean, they should be leading from the front, the hospitals, the general practices, you know, the other health aspects of transport, the ambulances and so on. We should be leading with that as an exemplar, really, for other industry. We also need, and one of your colleagues just mentioned this, we need small spatial scale monitoring. We need to know around our buildings and inside the buildings what the air pollution measures look like. And we also need to do what you've just talked about, which is to do personal monitoring to show across 24 hours what people are really exposed to so they can make choices. Now, the technology is all there to do that now. And I see over the next 12 months a lot more effort going into local air pollution monitoring so that people can be adequately informed to make decisions. And I reckon we're going to get some quite unpleasant shocks when people really realise what they're exposed to.
Okay, great. Thank you very much, Stephen, for that contribution. We're going to hand over to your questions now from the floor. The first question we have, I think this may be from an NHS trust on the line. It's saying that NHS trusts don't have the capacity to be able to offer company support, for example, to purchase an electric car or electric vehicle. Do you think there is an alternative? So perhaps I'll ask you to, what else can a company be providing as a way of helping people to cope with the air pollution challenge? If something like an optional EV purchase support scheme isn't something that could be provided. Are there any things that are entirely free or really cost effective to provide that help employees with this challenge?
Well, there's behaviour, I guess. I mean, just for now, there's behaviour, just to how you walk, where you walk, how you drive, driving fuel efficiently. All of those things help. Mm-hmm. No financial outlay. Yeah, and swapping away from diesel, I guess, where possible, to a cleaner car. If not EV, just maybe petrol.
Mm-hmm. Jamie,
yeah,
any extra thoughts?
I mean, I think there's certainly, and it plays a big part in terms of the behavioural things. A lot of the pledges we've seen throughout Twitter that are posted today on Clean Air Day, which is great to say. I guess the question is around what's the existing commercial relationship in terms of how vehicles are bought in the NHS, and obviously a lot of vehicles can be leased, which avoids the sorts of big upfront cost. So if that's not being looked into, that's certainly something that should be considered. And then also, you know, in terms of the supporting infrastructure around EV, look out to those organisations that are providing them more and more, and you know, with some sort of favourable rates around there. So I think there's a couple of things that can be looked on depending upon the existing approach.
Right, because we've got, I guess, the bike to work scheme, the cycle to work scheme, that doesn't cost the organisation anything, does it, to run that?
No, very little.
It's just a salary sacrifice scheme.
And maybe just sticking chargers. We put a charger in our car park many years ago, and it was idle for a couple of years. Now it's really, really busy. Okay. So just making it easy, making it available.
Okay, and I think that there's a number of organisations that are providing, you know, leasing schemes or charging schemes. Perhaps they will offer a discount to the organisation's employees. So you might be able to arrange things. That doesn't mean that you have to shell out yourself as an organisation to give employees a leg up in tackling air quality. Going to jump on to the next question, which is around the costs of EVs. And whether they are suitable for all needs. So the question was really directed to Jamie and how Engie will make it possible and more suitable to own an EV. Jamie, what's going on? What's going on with this world for Engie?
I'm not sure whether this is an Engie employee or somebody else asking how Engie can help them, but there's obviously limited scope of what we can do. But I guess let me try and explain the existing situation. So as I alluded to earlier on, the cost of the initial outlay of EV is more expensive, and we know that. The technology is increasing at an incredibly fast rate, the ranges and the price are coming down. So I think we're going to see those sorts of economic laws come into effect in the next few years. We've already mentioned in terms of making it easier, a couple of things. So the green car scheme that we launched is a way to provide direct savings for employees to get EVs. There's also sort of on a broader piece around creating the markets for this. So in conjunction with Global Action Plan, we are looking at a clean van commitment. So this is approaching some of the biggest fleets across the UK, trying to get them to make a similar commitment to what we've made in Engie. And I think this is about sort of creating the markets. And if the manufacturers know that the markets are there and fertile, so to speak, they are going to invest. And the more that you get into that, the more you will drive competitiveness, increases in technology, and therefore the prices will come down. But unfortunately, I don't think there's sort of, you know, a silver bullet for this issue of where we are at the moment. But always look to the whole life costing and not the upfront cost.
Great. Thank you, Jamie. We have another questions come in around this point of personal monitoring, if that is a helpful way to engage with the senior members of the team. The question is, are those monitors accurate? Are they for one-off use or for continued use? Can they be used in a car? There's a number of different questions here. Who would like to take this one? I can throw in some thoughts, but if you guys have experience that you want to share,
I'm happy to. I mean, you've mentioned it already. So if
I've mentioned it, and that came through King's College for us. But the one little thing that we did through Friends of the Earth, we were able to get little air monitors you could stick outside your door, or your you know, where you live, just to see what the air quality is like, and then at least you have some information. You might be able to do something more local about the air pollution.
Okay, so some static monitors that you were able to get from Friends of the Earth. Jamie?
I'm just going to pick up on one question here, which is around whether they're accurate. And again, we've partnered with King's College London for the last couple of years, doing some trials and such like. And actually, some of the clear messages we're getting around some of the monitors out there on the market are not 100% reliable. And so I think there's a word of caution really around that. And everyone is using data nowadays and using it to help make management decisions. And I think it's really important around the accuracy and the validity of these monitoring solutions, and working with a credible partner before making any of these sort of business decisions is vital, really.
Yes, I think I'll throw in there around, it depends what you're using it for. I think if you're using the monitor to illustrate the differences in exposure in a journey, then it's a very different thing that you're looking for from having a static station that is measuring pollution and trying to compare it to other parts of the country at any given moment in time. If you're looking for something that is just to illustrate the different pollution exposure in a journey, then I think you can look at some of the cheaper solutions. I won't give you names of any of the companies that we've worked with to do any of our monitoring experiments over the years, because I think that'd be unfair to talk about individual offers and that they get updated so frequently. But I would say if you're looking for a personal monitor, then do check what they are monitoring. That's I think the really important thing to ask. What chemicals is it that they are trying to monitor, and some of the ones that are the least expensive ones, they will typically monitor one form of one chemical, one form of pollution as a proxy for the range of pollution that you might find from, for example, traffic sources, which might be fine for your uses if it's just for an illustrative view of, for example, the CEO's journey to work. And they can be used in a car. Certainly some of them can and are used in cars. And we found in a number of experiments that exposure inside a vehicle, surprisingly, is often much higher than the exposure when walking or cycling. An experiment by King's College from the centre of London out into Camden was done at the same time of day by a driver, a cyclist, somebody walking, somebody on the bus. And the cyclist was exposed to 9 times less pollution than the driver, because pollution gets trapped inside vehicles as you go along from the exhaust pipe in front of you. You're in an enclosed space and it can't dissipate. Whereas when you're cycling, you're in the open air and pollution dissipates more. Okay, I have another question here around masks and face masks. And this, Stephen, I'd like to ask if you have a view on this one. Are the masks that we could wear whilst sort of cycling, or even as suggested in this question, while driving? Do masks work? Are they something we should use?
Well, I mean, my view on this is that many of the masks that have become available really are very inefficient, and they're extremely uncomfortable, but they're a great way of signaling to people the whole message about air pollution causing a problem. I think in terms of protecting individuals, wearing masks is probably not the direction of travel we should be going. I remember in London recently, there was a news article about children being selected to wear masks going to school. I mean, you know, what a dreadful situation that would be if we had all our kids with masks on walking to school or cycling. So I think they're great for individuals who want to make a statement. If they feel that they help them, well, fine. The efficiency of these things are very variable, and just as you talked about the air pollution personal monitors, I think if one is going to buy these things, one ought to look into the technology quite carefully before committing any money.
Yes, thanks, Stephen. I think that really chimes with some of the advice I've heard over the years, that unless the mask is absolutely skin tight and there's no way of getting the air to go into your mouth other than through the mask, then the pollution will just be coming in through the sides. So the sort of little surgical masks that you see being worn are really not having much effect in blocking out the pollution. So there may be some on the market that are, but they're probably the uncomfortable ones to wear, because they have to be that tight to the face to make sure there's no way of the air getting in other than through the filter. So that's some piece of advice from us there. Now I'm going to move on to another question, really going back into our sort of organizational campaign world. Let's say we're starting from scratch tomorrow, as many of our webinar viewers probably are. As we know, there's at least half of them have not been working on air quality so far. Where would you start? What's the first thing that you would do? If cast your minds back a few years, what was the first thing, either the first thing that you did, or if that wasn't the thing you would advise people to do, what is the first thing that you would advise people to do when starting their air quality campaign?
Well, the first, if I may.
Yes, please.
The first thing we did was our first campaign was called Step Into Health. So it was again about them individually, and then NHS recommend that each individual take 10,000 steps a day. NHS.
Yes.
Take 10,000
yes,
steps a day. That's correct, I hope.
Yep.
So that's what we launched, and just something very simple, something, huge issue, but you can do a little thing by just walking more for your optimum health. Just that really. That's how we started. We gave them pedometers to clip on their waist, and we came up with little maps they could open up to see where they, how in the city for us, and how they could get around the city within 5 or 15 minutes rather than hopping in a cab, because it's much actually slower. It's only travels only about 7 miles an hour, we believe, in the city. So that's where we started.
Okay. And why did you choose that particular campaign?
Because it was, so the NHS were recommending 10,000 steps a day. They told us also that the kind of standard commuter takes only about 3,000 steps a day. So we knew what we were aiming for. And it's something that people can do. And so that just gives them a taste. It's about them. It's something simple. We changed our posters, and we're encouraging people to take the stairs rather than the lift, trying to get out early from on their commute and stuff like that, just for their own active optimum walking and health. And then air quality and travel, obviously very much connected. Mm-hmm. We also threw in there the idea about going back to waste, about plastic. So if you're burning plastic, that's not very good for the atmosphere either. So we kind of threw that one in there to kind of link it all together.
Great.
Just simple little things.
Thank you very much. And Jamie, where would you start if you were doing this all again?
Well, where would I start? I think probably sort of, no matter what you do, look at what your material impacts are in terms of air quality and your exposure to them. So, if you're a manufacturing plant, your biggest impact will probably be from the use of energy on site. But if you're, a services organisation based in an office, it might be people commuting to and from work. So I think, being clear around what are the material steps that you can take which will have a material impact are important. But we shouldn't ever underestimate the power of, you know, the behavioural change side of things and the visibility. And actually, they're quite often some of the low cost things that can be done, as well as perhaps, you know, the more detailed business case that I outlined, and such like.
Fantastic, thank you. And Stephen, I'll hand over to you for the last word. What would you like to see organisations doing? Those organisations on the line of public sector and private sector. What would you like to see those organisations doing to help tackle the air quality situation we find ourselves in?
For me, as a medical practitioner, I think the first thing I'd like to see is the recognition that this is a serious health problem. A recent Lancet Commission said it's the #1 health problem now in the world, air pollution, far more than infectious disease and wars or any other problems. So we've just got to recognise we have a serious problem to deal with and not just sweep it under the carpet. The second thing I think we can do is to look at our organisations and obviously the people who work within them and see how we can do something imaginative and exciting to stimulate those working in those environments to take on the challenges that we've heard our guests talk about in this webinar this afternoon. I mean, every single organisation can do something here to help. And I think if they do so, that'll promulgate and spread the word to other people, and hopefully we'll get a movement going. And the final thing I would say is that me as a health practitioner, I would like my profession, the health and medical practitioners, to take some serious ownership of all of this and to start working through general practice and through various other health delivery mechanisms such as our hospitals to advertise and to demonstrate that they are taking this seriously. We have to lead from the front, and therefore recognition comes first, followed by action.
Fantastic. Thank you, Stephen. Jamie has just told me he's got one final thing that he would like you to know about how to make the best business case. Just going to throw in one final thought before we wrap up.
Thank you, Chris. I'll make this brief, but I've already mentioned about alignment of purpose and strategy, which is important. But I think that the bigger point, and it links with what Stephen was saying around understanding the external costs associated with the health impact from air pollution. I think if we saw more methodology come out around that, so we can understand the true social value around these issues, it's going to be good. And the final bit I wanted to make is the challenge. We've seen an amazingly inspirational impact from a recent TV documentary from David Attenborough. How do we create the next blue planet in terms of an approach around air quality? And I think that's the gauntlet that, you know, we should lay down to everybody.
Great. Very inspiring last call to action from Jamie. Thank you very much. I'd like to thank all of our speakers, Professor Stephen Holgate, Jamie Quinn, Teresa O'Brien. And just to wrap up, I'd finally like to say, please keep joining us with Clean Air Day. We run this campaign on behalf of 190 different organisations around the country, the Royal Medical Colleges, 50 local authorities, NHS trusts. There are health charities like the British Heart Foundation and UNICEF, and universities, and Global Action Plan's role is just to coordinate all of this activity. And so getting the word out there is a vitally important task if we're going to get people to really grasp this air quality challenge and solve it. So please, anything that you're doing on social media today around air quality, let's tag it Clean Air Day with the hashtag Clean Air Day, and that will make this noise louder and amplify the messages that we all have around clean air. We'd love you to stay in touch with us on Clean Air Day and various other related issues, especially around how GAP can perhaps help with your organisation's air quality campaigns, and any feedback you have for us on Clean Air Day. What would you like us to be doing with this next year? So please sign up to receive our Clean Air Day newsletter, and details will appear on your screen very shortly when the webinar closes. So you'll be redirected to a sign-up page. So finally, thank you for joining us on Clean Air Day. Please do show your support with that hashtag Clean Air Day, and we wish you all the best with creating positive change in your organisation on air quality. Thank you very much.